So hello everyone. So on behalf of Vietnam National Lung Hospital, I will talk some information on the opportunities and the challenge in implementation of the new tool project in Vietnam. Next slide. Next slide, please. So there are four key information that I'm going to share in this presentation is our preparation on implementing the new tool projects with some key milestones. The second is about the double X strategies that we going to use in Vietnam, especially after COVID-19 pandemic. Thirdly, we will provide some information on the implementation of the active case finding as well as the identifies case finding as health facilities. And the last one will be some challenge in implementing the project in 10 provinces in Vietnam. Next, please. So let's talk about the preparation for the project. We actually, next slide, please. We actually signed agreement with Delft TB partnership in May 2021, and it takes about 6 months to get the importation permit for all the UP X-ray system as well as the CAD4TB. And then in Jan 2020, we received all the UP X-ray system and CAD4TBs. And this arrived Vietnam before Tết holidays. That's the reason why we conduct the trainings for the central level as well as the province staff in February 2020 and in March in 2020. We following the guideline from the debt companies before we transfer the UP system to the province. We sign a warranties agreement and send back to debt before sending out the UP X-ray system to the province and to do the installation outside in February and March. Actually, it is done right after the training session, and the implementation start in some province in March in 2020, and I will share some information about the implementations in the section 3 of this presentation. Next slide. So let's talk about the UP X-ray and CAD4TB implementation in 10 provinces. So as you can see that following the Vietnam laws, we need a kind of license registration with the local authority. So you can see we up to date we still have 3 provinces that still pending on getting the approval from local authorities on the certificates of the verification as well as the CAD X-ray license for implement such kind of system in their activities. The second column, as you can see that this is the way that the province decide to use the UP X-ray system in their NTP activities like in Hanoi. Only in Hanoi we have used this system for health facility activities. Most of the province have used the system for both active case finding at community and health facilities. Next, please. So let's talk about some information about the double X strategy in Vietnam. This is also the opportunities for our implementation in this project. Next, please. So there is, the COVID-19 pandemic is affects much on the NTB control and the appearance of the NTBs nationwide. You can see that many states of COVID-19, and we reach the fourth waves of the COVID-19 is much effect to the national control TB program. Next slide, please. So we can see the big gap. Next, please. The big gap in the the notification compared to the the one that we have in 2021. So actually compared to the when we compare the data from 2021 with 2020, we can see the overall reduction of in notification is around 2%, and when we compare to the data in quarter 1 2022 compared to the notification rate in 2021, we can see there's been a significant reduction in TV notification, which is worth 70.8%. Next, please. That is the reason why the NTB strategy is designed to optimize the use of experts and X-ray in detecting TB case, especially in after COVID-19 pandemics, and because of the TB reduction is really affect to the achievement to the ambitious goal of the ending TB by 2020. WHO have been expanded to nationwide for active fighting communities. And because of the effect of the COVID-19 wave, the first wave, from January 2020, the leader of NTBs also decided to use the double-X strategies, expand to all the TB health facilities beside the active fighting community for high-risk group. Next, please. So actually, the WHO is issued on October in 2020, and it had been updated in 2021, of which AI were added to the algorithm. And this strategy is applied in active case finding at communities as well as the routine and identify case finding as a health facility. Next, please. So this the picture is the day that we roll out the double strategies that applies for the ITK fighting in 2020. Next, please. The double strategies we focus on the target group for the the high risk group people, household contacts, the alcohol, the smoker, or the elder age above 60 years old, and as well as the presumptive TB. Next, please. The slide is showing the algorithm that we use in ITK fighting at community level. And next slide will show you the algorithm that we apply in health facility. As you can see that beside the target group that I mentioned in the previous slide, we use this for the routine activity screening as well. So that's the reason why we add the group of presumptive TB here in the first box of the algorithm. Next, please. So let's talk about the implementation of the Newton TB projects in Vietnam. Next, please. So there are many activities that we conduct as 10 provinces that receive the 10 UP X-ray system in Vietnam. Firstly, we develop a technical guideline on UP X-ray and CAD4TB implementation, and we use the resource, the reference from the guidance from the dev company, as well as the information that we receive from research from other activities, similar activities implementation. During the project, we also decide to conduct a monthly coordination meeting. There are 2 coordination meetings within a month. The first one will be the coordination meeting between NTBs and the Stop TB partnership and other stakeholders that support for the new TB project implementation. The second one will be the routing meeting with between NTBs essential labor with 10 provinces that receive the 10 UP X-ray system. We also provide some the technical support through social WhatsApp or Zalo. This is with an application in Vietnam. And this group involves all the technicians and the focal boy, as well as the NTV leader in this group to in order to provide support and answer in a good time manner any question that raised from the province. We also conduct the fellowship report to supervise as well as provide support in connecting the UP system and the connecting system with the active findings activities at provincial level. We also realize with the dev company and other stakeholders to discuss about the test hole calibration as well as the printing team. We also discuss some, the solution that to optimize the implementation of the project, the active finding community as well as the health facilities. We also provide some, guidance on the extracting data, the images and image from the CAD4TB system for further consultation by the medical committees. Next, please. So here is the way that we use the UP X-ray and CAD4TB in active case finding. As you can see in the picture that we use the system together with the mobile band X-rays. The left hand side, the picture on the left hand side is the mobile X-ray that we have for any active case finding, and on the right hand side it is the system that we receive from the stock TB partnership with these dev from dev companies. Next, please. So it is a way that people, set up the system when they do the active case finding as well. So as you can see that most of the places that they set up the UP system is at community health level, community health station. Next, please. And because we have CAD4TB as well as in the algorithm, all the abnormals check X-ray film will be referred to the doctor to review again before decide to provide the expert test for TB's diagnosis. So this is on the left hand side. This is the one that the doctor can see the result of the check X-ray readings through CAD4TB, and the second one, as you can see, we have two screens. The one on the right hand side, it is the laptop that we provided together with the UP system, and the second screen on the left hand side is the one that we bring in any active case finding. People from the active case finding, they will send the image of any abnormal check X-ray film to a kind of app, and with this Zalo here. So to the doctor, and he can review the film and decide whether we can refer this patient to further test for TB diagnosis. Next, please. So one of the issues that we recognize during the fellowship is it takes long time to to hang the detector in the good time manner, followed by the guides from the dev. So we decide and discuss with the stakeholder and USAID Vietnam that there have a kit here. As you can see, it may have it can be used for hang the detector of the UP X-ray system in a good time manner. So the quality of the check X-ray is not affected by unstable of the detectors. Next, please. So this is a project report that we received in Q1 2020. We got very few province received. There are 5 provinces received the training in February, and they also received support from our local authority as well as the global fund budget to do the active case finding. So as you can see, very few provinces have conduct the active case findings in Q2. Only 4 provinces have report their data and activities in Q2. And we got a visit after screening. We have only identified 9 TB patients amongst around 2,000 cases that screening in Q1 2022. Next, please. This slide shows the project up to Q2 2020. So only once province that they didn't report the data because of some issue in setting up the UP X-rays, and I believe that the liaisons have to send the request to the desk service to about this issue, and also we are going to go to this province to understand exactly the issue of the UP X-ray system setup in this province, and have more idea on how we can solve this problem. So that is the reason why we have only 7 provinces have data in Q2 2020. But in general, we get, as you can see in the slide, that we detect around 80 patients TB, both in bacteria confirmed as well as the clinical TB case amongst 6,000 TBs and 6,000 people that screened for TBs in active case finding as well as the identified case findings at health facility. Next, please. So during the fellowship, so at the from the time that we start the implementation of the active case finding at community level, as well as the identifies case finding at health facilities, we have some challenges that face as well. Please next, please. So we, as you can see in the previous slide, we use the X-ray system in parallel with the mobile jet erase van because of the the capacity of the UP X-ray system. It takes only 200 film a day. Why the active case findings normally we see about 1,000 case per day. So that is the reason why we do need the mobile X-ray vans go together with UP X-rays in the active case finding, and that is mean that we need more staff for jet X-ray screening for TB only. And the second thing is about the batteries, because this is a limitation of the time that you can use battery. So it it may be delays, create some delay in jet X-ray screening, and it may affect to the whole process of active case finding at community level. And as mentioned in previous slide, it takes time to handle the detector in a good time manner to ensure the good quality of the jet X-rays. And we also discussed about this, and we suggest that have a kind of kit that is made by Vietnam company. So we may purchase such kind of kit to handle the detector as guided in the manuals from there. And the fourth thing is about the threshold, because for the initial time, when we do the screening, the threshold is fixed, and we cannot calibrate it beyond, the some information on the, high variance and some factor that that affected to the threshold level, because it is fixed, so it may lead to inappropriate use of expert test in some setting, lies, because it's fixed, and then we may, use the expert test more than, expected. And the last one is related to the printing film from the, from the system, because if a person who have abnormal inject X-ray film, but they don't have any, physical symptom, so it is necessary, it is required from the national guideline that we need to print out the film and bring it to the medical consultations committee to review. And for the first time, it is take time for us. It takes about 1 month with support from IT technician at the hospital to fix this issue. So the first connecting between printing machine with the UV X-ray system is had just completed in Cần in early this month. So it is the challenges that we face when we implement the TB Newton project using the UV jet X-ray system in Vietnam. So that is for this is all. Yeah, thank you.